Hello, welcome, thank you for being here. My name is Emma Hinze. I'm the ER manager here at Frederick Hospital. Today I'll be going over how to take manual vitals, including blood pressure, heart rate, and respiratory rate in the case of an emergency situation. According to the Importance of Vital Signs, written by Fire Engineering on the 3rd of September 2019, vital signs are used to determine which treatment protocols to follow, and they are important information needed to make life-saving decisions. Now I will be going over the range that each of these vitals should be in. So for blood pressure, it should be between 90/60 to 120/80. For breathing, it should be between 12 to 18 breaths per minute, and for pulse, it should be between 60 to 100 beats per minute. And this is from this is from Medline Plus Medical Encyclopedia, which was updated on the 6th of January. Now I will be going over the parts of each of these two pieces of equipment. So for the stethoscope, I can pass around the diagram too. Here you go. We have the two earpieces, which you would put in your ear, and then we have the tubing, which extends down to this would be the diaphragm, which you would place on the area where you're trying to listen to the heartbeat. And then, if you want to flip that over, we have the diagram of the blood pressure cuff, and on this we have the pump, which you would use to inflate the cuff, and then we have the actual cuff, which you would place around the upper part of the arm. Then we have the diaphragm right here, which you would use to look at the numbers, including the systolic and diastolic. And then we would have the valve, which you would use to deflate the cuff. Now, also too, the diagram for the stethoscope comes from the Parts of a Stethoscope made by Shelley, which was made on September 25th, 2019. Can I please have a volunteer to go over how to demonstrate these vitals, please? Okay, Hope, come on up. Okay, so the first set of vitals I will be demonstrating are blood pressure. So I'm going to place the blood pressure cuff on her upper arm, and then I'm going to place the artery marking on her artery, which would be her inner arm. I'm going to tighten it, and then I will place the dial here so I'm able to read it. And then I will use my stethoscope to listen to her heartbeat on her inner elbow area on her artery, and then I will make sure that the dial is closed, and I will pump it up to around between 180 and 200. And then I will release the dial so that the cuff deflates, and the first sound I hear will be the systolic number, and then the last heartbeat sound I hear will be the diastolic number. So I'm going to deflate it. Okay. So I got 118/78. So 118 would be the systolic number, and 78 would be the diastolic. And yeah. Next, I will be going over how to do the heart rate, and I will be using her wrist to feel for her pulse, and you will feel that on the outside of the wrist. Once I feel it, I will count to 30 seconds, and then I will multiply that number by 2. So, for demonstration purposes, I'll just do it for 10 seconds. Okay, so I now will take that number that I got for 30 seconds, multiply it by 2, and that will be my beats per minute. Next, I will go over respiratory rate, and in order to do this, I will just look at her chest, but don't tell them that you are going to be taking their respiratory rate because it can affect how they breathe. So just casually glance at their chest and watch as her chest will rise. And you're going to be doing that for a full minute because it's a much slower count. So let's say I did it for a minute. That will be my respiratory rate, the amount of times her chest raised in that 1 minute. Thank you. I'm done with that. So just to go over the main points again, for blood pressure you will be listening for 2 numbers, the systolic, which would be the first, and the diastolic, which will be the last. For heart rate, you're going to measure it for 30 seconds and multiply that by 2, and that would be your beats per minute. And for your respiratory rate, you're going to count for the full minute, and that will be your breaths per 1 minute. And I just wanted to let you guys know that it is important that you are learning how to do this manually because nowadays people are not trained as well on taking manual vitals due to the advancement of automated machines. So it is important that we are aware of how to do this in emergency situations. Does anyone have any questions that I can answer?
So when would you need to take manual measurements versus having the automated equipment?
Well, if you're not in a hospital setting or if you're transporting someone and do not have the automated equipment available to you, then you would have to use a manual way of taking the vitals. But if you do have the automated equipment available, then I would do that instead of manual because it does have more precise readings.
Okay.
Yes?
If we're doing a vital and the reading is something that's not in the normal range, what should our next step be? What should we do?
Well, I would immediately tell your supervisor or manager because those could be a life or death situation. And then I would chart it too because we may need to go back and look and see what those numbers were later on.
Okay, thank you.
Well, thank you for coming. I hope that this is useful to you, and I appreciate your participation. Thank you.
Thanks.
Thank you.